Good morning and very warm welcome to all. My name is Gunjan Kumar and I'm a healthcare technologist with Sahara India Group, Sahara Hospital Lucknow. It's a 554 bedded hospital, super specialty tertiary care corporate hospital in Lucknow. Before I begin my presentation, I'd like to first of all welcome you again, and I know every one of you is quite excited about today's session, and I'll try to make my deliberation as interesting as possible, and as discussed earlier, the questions can be put up towards the end of the session. I had to actually realign my presentation after reading this healthcare IT survey pamphlet, which says that India in the past has lagged tremendously in the adoption of IT in hospitals as compared to Western countries. I hail from a healthcare corporate hospital, work mainly with corporate hospitals, and today I've tried to realign a couple of minutes back. So I'm trying to speak more focused on community level. I'm trying to realign my presentation on Indian subcontinent. I would not like to speak mainly about corporate hospital, which we have been doing in earlier forums. We speak about high-end technology. I being a healthcare technology, I fancy and I'm quite passionate about telemedicine, telerobotics, high-end ERP systems. But after listening to the deliberations by other speakers, I also felt that and I'm impressed that the Ministry of Healthcare is taking a lot of good initiatives. But the fact of the day and the matter remains the same is that despite of the fact that we Indians being amongst most intelligent breeds in the world, been doing a lot of innovations, and worldwide, all of a sudden there have been a lot of healthcare innovations happening in the Western world, especially in India also, but they are quite fragmented. And that's how I would begin. I would try to be more focused because 7 to 8, 10 minutes will be too short to cover all the things what is happening around in healthcare sector. But the main focus of my presentation would be, once we leave today evening, we take away a food for thought, something which we can do which is more practical, applicable to Indian subcontinent, due regards to everybody who has been doing and putting in initiatives, efforts. But I think that's my perspective, and that's my personal perspective towards taking healthcare and healthcare IT together forward. As I said earlier, mostly we have been speaking about, and I personally have been speaking about, what is required. And I think most of the people sitting in this room would be knowing what is required. But today, because of the constraint of time, I'll straight away hit to the point that how we can achieve it. How healthcare IT can reach up to most of the healthcare setups, whether small, medium, large, even nursing homes, government hospitals, PHCs, and any of the smallest of the medical service units in the country. I firmly believe that unless until we align and bring up or reach a certain milestone, I think it has to go in a phased manner. Because what has happened is corporate hospitals, they have the benefit of funding. Although we being in a corporate hospital, always healthcare IT people are also called back for ROI, which is again a different challenge. But when it comes to a mass deployment, a national level project, everybody has to take an initiative, and everybody has to set and take baby steps, set up small milestones to achieve, so that we can improvise the healthcare delivery system using information technology, information communication technology, as well as raise the confidence level of people, educate them, make them comfortable with the technology. As I always said, that progressive healthcare organizations, I say progressive healthcare organizations mean even the smallest of the setups, smallest of the nursing homes, even the clinics, need to realign themselves with the healthcare information technology systems, ecosystem, and be more creative and innovative on use of information technology. I'll come to this point again and again, that creativity and innovation actually makes technology more comfortable, affordable, and accessible. Now, there are multitude of benefits you can get by incorporating information communication technology. But to name a few, we can increase our clinicians' efficiency, our nursing staff efficiency, and everybody involved in healthcare delivery system. The clinicians and the nursing staff can make informed decisions. They can minimize medical errors. And then they can have consistent clinical data. Now, I'll start again backward. I'll give you a simple example which I narrate to most of the people is you draw your blood sample a little bit more today and just send it across to different pathological labs in the city. You ought to get different results. So we have a basic standardization challenge there itself. And that's why today I'll try to put up technology in the most simplest form. I'll try to put up technology so that we can reach to a certain level where we can vouch for clinical reports, we can vouch for clinical outcomes most of the times. We can also have more confidence on the clinical, on healthcare delivery system. Now, how to make technology work in healthcare? Simplicity of technology is the key to its acceptance. We have been operating our remote controls of a TV and VCRs earlier, now DVD players. Now they are quite intuitive. So simplicity actually makes it more comfortable and the acceptance increases. The flip side of technology today is that no matter however, most of the healthcare IT companies, the big names also, they always claim and they try to. Probably the technology is, quite complex that they are not able to simplify it much. But I firmly believe that why do you bring a big technology feature if you can bring a smaller version of it, a simplified version of it, increase the acceptance level, and then move forward for a more complex system. Stability of technology is the key to its success. Whenever, I'll ask you a simple question, in fact you can ask it yourself. In the morning when you charge your mobile, and at night when you charge your mobile, do you ever doubt that tomorrow morning your mobile will not work? Do you ever doubt that your mobile phone, before making a phone call, that it may not search for a number which is saved in it, or it may not be able to dial, provided the network is there? You don't. Because over the years, we have attained stability in telecom. Why not in healthcare ICT? The next is that more we do with standard simple solutions, we can end up doing mass deployment. That will bring down the cost. So the cost comes down. Again, we can take further initiatives. Confidence building will take place, and that way we can actually reach to a certain level and bring most of the healthcare delivery setups to a certain level where the information communication exchange can start happening, and that is the future. As I said earlier, I'll be more focused on a certain topic because the time prohibits on touching each and every domain. So today I'll focus on medical diagnostics, and I have been living day in out with clinicians, nursing staff, doctors, everyone, surgeons. I've realized that over past years, our clinicians have to undoubtedly depend a lot on the medical reports, whether they are medical medical diagnostics, whether they are pathological reports or radiological reports. Primarily, they focus on these two, and I have actually thought of a solution which I proposed, which can actually support the clinical quality outcome and the confidence level of the clinicians. Most of us know that the labs, the pathological labs, they should and they would be having a lab information system, lab automation system, lab equipment integration, lab equipment interfacing to the LIS. Now, the fact of the day, and we should not shy from the fact, there would be hundreds of LIS solution providers in the country. But every time this solution provider or vendor, most of the time have to send a person to integrate your machine. The stability of consistency of information exchange between your machine and the interface, nobody guarantees. Why not we stabilize that system? Why not we make small form factors of system? Why not we standardize systems so that it becomes more of a DIY to yourself, where the IT team of your smallest setup, of your region, of your city, small vendors can come and put that box and actually exchange, transfer real-time data from your pathological equipment to your basic Excel and Word format, so that even that medical, the data error, which result to a large medical error, wherein the lab equipment machines people buy the standard ones, they go for one of the decent ones or the standard ones or the expensive ones. But they fail to understand that people read the clinical data outcome, lab data outcome, and then again type on a piece of paper at most of the places. So that simple interfacing can reduce the medical errors to a large extent and raise the confidence level of the clinicians also. And the second is quality assurance. People refrain to run QC tests on their lab equipment. So I insist that they should, for consistency of lab results. The second is more exciting one, is radiological information system. Most of the cities we have seen, the trend is changing, but the smaller cities still have a lot of small diagnostic centers which have like X-ray centers or ultrasound centers. But I'm sorry if somebody have a different opinion, but I don't find many of qualified radiologists sitting out there reporting. So probably you've bought a GE or Siemens or a Philips machine to do X-ray, make it very simple, or ultrasound. But do you have that qualified or competent radiologist to comprehend that image? I doubt that. So why not I propose a solution which is very much workable today, and that is a cloud-based solution. Now, I do understand cloud is more of a jargon used these days, but yes, the people who are really smart are using it today. What we can do is, we can actually push the images captured on the cloud. You don't have to invest on the packs. The packs reside on the cloud. And then the reporting can be made to do from competent radiologists. So the small X-ray or ultrasound center can even save on the cost and the challenge of retaining that expensive radiologist at his setup. I'm trying to summarize it. Probably the questions would come at the end. I do understand that probably I have tried to explain a complex scenario. I do understand again, and please ask me questions about this because I have to run through the further slides. I think I've just crossed the slides. I say SMS is the future. It's not that messaging service. It has more to do with smart mobility solutions. They have been smartphones, tablets, portable monitoring and diagnostic gadgets. And believe me, why they are the future? Because when we try to go for, again I'm using a technical term, while we go for a desktop-based applications or softwares, there's always challenge of viruses, OS crashes, data loss, blah blah stories. Why you rely again on, I would ask you rely on your mobile phone? Because it is an embedded technology. Why you can rely more on your microwave oven rather than relying on a desktop computer, which any day can be infested with virus. Any day it may crash. So the fact of the day is you have to have individual embedded systems. People would have different school of thought, but the data tells, the fact says that you need to have embedded systems so that they are built for purpose and they are more rugged. While coming to Delhi from Lucknow, in the aircraft there was an announcement. The fasten seat belt signs are off. Please, you may switch on your laptops and iPods. What is iPod? iPod is not a generic term. That means a company by the name Apple actually has established iPod more relevant as a term rather than a Walkman or a portable music gadget. So why can't we try and take an initiative as technologists to develop a health pod? We should have a health pod vis-a-vis iPod. These are the slides trickled down from my earlier presentations where I speak about patient bedside monitoring system, pneumatic tube system, patient live video transmission system. These are things which we have already achieved in our hospital. Now these are more relevant to a larger corporate hospital, but I'll try to take you through what are our past achievements. We have healthcare grade networks, so again more relevant to a corporate hospital where we have plenty of fiber optics running around, network switching servers. I'll just straight away take you to one more thing, is that if people who are from a private or corporate hospital around, this is the way to the future. So if anybody has a challenge to invest on desktops, please don't buy desktops. There's a better solution. You can virtualize your desktops. You don't have to have intelligent device with hard disk and blah blah stories running next to you. You can have a centralized based virtualized desktops, and as the technology progresses, every year you can upgrade that particular desktop for at least next 3, 4, 5 years. So I'll summarize my deliberation over here. Again, there was a shortage of time. Thanks for your patience. Thank you.